I hear really two fundamental issues. From the other side of the aisle, I hear the conversation being about free. This is free, we need to take it, and it's free. And we need to do it now. And that's sort of the fundamental message that my brain receives. Now, my brain, being a man's brain, sort of thinks differently. Because I say, well, it's not, if it's free, is it really free? Because I say, in my brain, there's a cost to this. And there is a cost to this. I mean, the reality is, nothing's free. There's a cost to this. And the costs are numerous, and I won't belabor them. We all know the money comes from the federal government, it comes from taxpayers, it comes from governments overseas that are lending us money because our economy isn't working the way that it should be. And so I sort of see this fundamental conversation between free versus cost. And everybody understands the underlying merits of the bill. We all want to have people have access to health insurance, whether it is possibly through an exchange, maybe a subsidy, whether it's free or not. I mean, we all believe, generally, that people should have access to that. It shouldn't be something in society that we should have to work towards. But it's a reality of our society today that you can't just have universal health insurance. It's not something we do in this country, because we generally can't afford it. So, what troubles me about where we are today, almost 5.5 months now into this legislative session, is that we have not truly sat down and had the conversation between men from Mars and women from Venus. We've had the conversation about we're right on one side, and we've had the conversation on the other side that we're right on our side. And nowhere have we really sat down and talked about this in a meaningful way to say, how is this best for Maine? We know that there are other states, for example, Arkansas, that under the flexibility provided by the Affordable Care Act, designed a program for Arkansas that's essentially based upon an insurance-based system. That's what fits and that's what works for Arkansas. Now, in Maine, we really have not had that conversation. We have not allowed the chief executive in a meaningful way to partner with the legislature, to partner with the majority party and the minority party in the legislature, to talk about what is the best package for Maine. And so we're here today with the bill in this posture because we simply have not had that meaningful conversation. I think that's unfortunate. This is a body where debate is supposed to be encouraged. We fight wars so that we can have debate, so that we can have disagreements. And what we've had in this process is a process whereby we haven't had the opportunity where people can come together on this and do this together in a bipartisan way, to do this together with the executive, the legislature, working with the federal government to do what's best for Maine. And the result of that, the end product of that lack of a conversation between men from Mars and women from Venus is that there's going to be I believe there will be a substantial amount of folks on my side of the aisle that will simply not support this because we have not had that meaningful conversation. And I think that's unfortunate because Republicans do believe and they want to help the poor, they want to help the middle class. We believe that there should be access to health insurance. There should be access to services that people need. But we have to do it in a responsible way, and I believe that on our side of the aisle, that's the way our brains work. Because we look at the cost component of this, not the it's free component. So I think it's unfortunate that we have not had that meaningful dialogue, and I do believe that's a dialogue that can continue in the future. And I hope we have an opportunity to do that in a bipartisan way with the chief executive and with the federal government. With that, Mr. Speaker, I request a roll call.
Representative Newport.